Hello and welcome to the Mesa Messenger vlog series. I'm Tyler Franson. Republicans recently failed to get a vote on the bill that would have effectively repealed and replaced the Affordable Care Act, or as it's also known, Obamacare. This bill, the American Health Care Act, would have probably cost 24 million people to lose their health insurance and would have also done nothing to reduce the deficit. This was reported by the Congressional Budget Office, who is nonpartisan and also usually pretty accurate with their estimates. There are three main reasons why this Republican healthcare bill failed. Reason number one, it was rushed. The Republicans had 7 years to wait and build this plan that would have been a conservative's dream for American healthcare and for the future of American healthcare that would have done what the Affordable Care Act could not do, which was lower cost. The plan, yet, in the end, seemed very slapped together. It seemed very much like a hack job. It didn't seem like it was 7 years of buildup for it. It seemed like it was 7 minutes of buildup. They barely had the numbers in from the Congressional Budget Office to review what kind of fiscal impact that this bill would have had, and yet they wanted to push a vote for it anyway. Reason number two, it alienated moderate conservatives. By the time the Congressional Budget Office released their numbers that said 24 million Americans could lose their health insurance and that prices would still continue to go up, specifically in terms of deductibles and premiums, moderate conservatives said, this bill doesn't work. No matter how fiscally conservative a plan it may be, no matter how much thought went into it, 24 million Americans losing their health coverage is not a good thing, especially if those conservative voters that face a greater risk of losing their health insurance voted for the party. And reason number three, it alienated more fiscal conservatives. Again, the plan would have more than likely cost 24 million Americans their health coverage, and it also would have continued to raise premiums. The trade-off that the Republicans proposed was tax credits. Those tax credits would have increased spending, and that increase in spending would have continued to increase the deficit. The increase in spending and the increase in deficit is like the sound of nails on a chalkboard to a fiscal conservative. The plan would have raised spending, and the plan would have caused more problems than it would have tried to fix, so it was going to fail no matter what. The White House and the relationship it has with House Speaker Paul Ryan was very much tested during this process, and unfortunately, it caused some strain. Americans really can't afford to have a dysfunctional government, especially when it revolves around people's health coverage, because in a lot of cases, health coverage can literally mean life or death. I would argue that Americans need, now more than ever, especially as we think about the midterm elections and 2020, we need now more than ever to think about who our politicians are that are effectively running our government. If they propose policy ideas that will cause more harm than good, then why would we elect them? And the proposal made by Speaker Ryan and by the President and by every Republican that was in favor of the measure, it didn't aim to solve some of the problems. It just aimed to repeal the Affordable Care Act. When you start playing partisan politics with people's health and people's lives, I'm sorry, but I don't think you deserve to be in office anymore. Those are my thoughts, and those are the thoughts of me and myself alone. They do not reflect the Mesa Messenger, and they do not reflect Colorado Mesa University, and they do not reflect the city of Grand Junction or the state of Colorado. They are personally my thoughts. This has been the Mesa Messenger vlog series. I'm Tyler Franson. Thank you, and have a good night.